Alzheimer's New Zealand has produced these videos for anyone who wants to know more about dementia. You can view these video chapters in one of two ways. Either play right through from the beginning or select the topics that are of most interest to you. Receiving a diagnosis of dementia can be a big shock. It's comforting to know that there is a lot that can be done to help people with dementia to live well. Access to information and advice can make a big difference. The word dementia is an umbrella term used to describe a group of different conditions that trigger a gradual loss of brain function. Alzheimer's disease is the most common and well-known form of dementia. Other forms are vascular dementia, frontotemporal dementia, and dementia with Lewy body. These conditions affect how well our brains work when we think, remember, and reason, also known as our cognitive ability. Dementia is different for everyone. Generally, the most common dementia symptoms include changes in memory, thinking, behaviour, personality, and emotions. But what symptoms are experienced and how quickly they develop is unique to each person and depends on the parts of the brain that are affected. For most people, the changes are gradual, as it spreads through the brain, leading to the symptoms getting worse over time. As the dementia progresses, it will affect a person's ability to look after themselves and do everyday activities such as getting around, having a shower, or getting dressed. The early signs and symptoms of dementia can be subtle and hard to recognise. Many conditions such as stroke, depression, and infections, as well as normal ageing, can cause dementia-like symptoms. It's important not to assume that changes are due to dementia and to talk with your doctor if you have any concerns. Anyone can be affected by dementia, but it is more common in people who are over 65 years old. And as people get older, the chances of developing dementia increase. In less common cases, dementia can strike early. This is known as young onset dementia and can affect people in their 40s or 50s. Here in New Zealand, an estimated 60,000 people currently have dementia. As our ageing population continues to grow, this figure is expected to rise to approximately 154,000 by 2050. Some forms of dementia can have family links and may be hereditary. Around 1/3 of people with Alzheimer's disease have a close relative who has or has also had Alzheimer's. For the other 2/3, there is no family history. The early signs and symptoms of dementia can be subtle and hard to recognise. These are some of the most common signs of dementia. We all forget things occasionally. What we're talking about here is forgetting names, meetings, or telephone numbers regularly, as well as trouble remembering conversations, repeating conversations, or questions. Difficulty performing regular tasks could be something such as having regular difficulty driving a known or familiar route, or putting the jug on for a cup of tea. Language problems might include having difficulty following or starting a conversation, or using the wrong words. Sometimes the body clock can go into reverse. People can experience confusion about the time of day and what is appropriate to do. Things like making bad decisions on a frequent basis and paying less attention to physical appearance. This could be having trouble keeping track of finances or managing to plan and cook meals. Repeatedly putting things in inappropriate places, or a regular pattern of misplacing the same items. Rapid mood swings, from calmness to tears and anger for no apparent reason. Suddenly becoming either more outspoken and less considerate, or becoming more socially withdrawn and less confident. Loss of interest in or being unable to do things that were once enjoyed. People can show one, a few, or all of these symptoms, and the symptoms can progress at different speeds because dementia is unique to each individual. It's important to remember that other conditions can cause dementia-like symptoms. If you have any concerns about a family history of dementia, or you are worried that you or someone that you know may have dementia, in the first instance you should see your GP. The general rule of thumb is that what is good for the heart is good for the brain. There are ways to potentially reduce your risk of developing dementia by maintaining good brain health. Here are 5 simple things that we can all do to reduce the likelihood that we will develop dementia. Things like high cholesterol, high blood pressure, diabetes, and obesity all damage blood vessels. These increase the risk of heart attacks and strokes, as well as the chances of developing dementia. Leading an active lifestyle can help control your blood pressure and weight, and make you generally feel better. It's also a good way to connect with friends and family. Some evidence also suggests that being physically active can help reduce the risk of dementia. Our body and our brain both rely on food for fuel. In order to keep them functioning properly, we need to consume a healthy, balanced diet. Eating lots of fatty and processed food is associated with a higher risk of heart disease and is best avoided. By challenging the brain with new activities, you can help build new brain cells and strengthen the connections between them. This may be helpful in slowing the decline in thinking abilities. Social engagement may also be beneficial to brain health because it stimulates our brain reserves, helping to reduce our risk of dementia and depression. Try and make time for friends and family. You could even combine your activities with physical and/or mental exercise through sport or other hobbies. If you know someone with dementia, you can play a vital role in supporting them and helping them to live well and play an active and valued part in their family and community. Put simply, the most important thing that you can do is stay connected with them and support them so they can keep doing the things that they love. As the condition progresses, it can have a big emotional, social, and practical impact, both on the person and on their close family and friends. That's why having someone there to help makes such a big difference. By better understanding dementia and how it can affect people, their families, and friends, we can all help create a dementia-friendly New Zealand. If you or someone you know is showing signs of dementia, the first step is to talk to a GP, or you can ring your local Alzheimer's organisation on 0800 004 001. And if you would like more information, you can visit www.aboutdementia.org.nz.